Good day everyone. I'm Ivan, the moderator for this webinar. I welcome everyone to today's webinar, which is Durable Medical Equipment, Prosthetics, Orthotics, and Supplies Assigning the Correct Code. I want to introduce our presenter for today, Michael Strong. Mike Strong has been working in healthcare for nearly 20 years with payers and providers. I would now like to hand over the floor to this speaker. Over to you, Michael.
Thank you so much, Ivan. Welcome, everybody. So as Ivan had indicated, today we're going to focus on durable medical equipment and the compliance aspect around correct coding. Durable medical equipment is something that has caused some concern for individuals because when the guidelines were originally created, there really were no guidelines. And to this day, there really still is a lack of published guidelines within the HCPCS manual or within each individual code, creating a lot of confusion as to how do we bill these services. This is an opportunity to learn about what sort of methodology we can take in order to properly code these services completely and ensure that we are getting as accurate as possible when we're doing this, recognizing that some payers may have different sets of guidelines. Today, we're going to have a few different topics. We're going to focus on our coding overview, the FDA pre-marketing notification, DME coding, which will include your PDAC, manufacturer, and LCDs. We're going to also take a look at the DME modifiers and how they could impact us. The NCCI edits that primarily drive a lot of the bundling logic or even medically unlikely edits around it, especially when you're dealing with frequency. And then we're going to also talk about coverage and supplies in an office. Briefly, we'll touch on in a facility as well. So I'm Michael Strong. I'm the gentleman on the left side in the color aspect of the screen. And Scott is my business partner that works closely with me. In terms of a little bit more about what we're going to do today, I first want to take an overview as to how coding really works so we can really dive into this durable medical equipment, recognizing that there's so many different angles to it. So when the standard transaction code set was adopted, they adopted only a few areas of coding. They adopted CPT, or the current procedural terminology set, HCPCS, which is the Healthcare Common Procedure Coding System, CDT, or the current dental terminology. ICD-10, CM, and PCS have since been adopted since its rollout in 2015. Originally, it was ICD-9 that was adopted. And then NDC, which is the National Drug Code, which you would utilize in pharmacy services. So when we look at the HCPCS codes, I'm going to focus a little bit on what's out of scope before we go into what's in scope. From there, we then talk a little bit about our H code. We also have our R codes. Let's get into what's in scope today, how a device is able to be marketed and sold. And that starts off an entire chain of events that eventually create the guidelines that we use today within durable medical equipment. So the first aspect is really looking at the Food and Drug Administration pre-marketing notification, the durable medical coding, the manufacturer, the PDAC, and the LCDs, because we have to ensure that when these devices are being approved for pre-marketing, as that notification letter stated. So what are DME categories? So this also impacts us when we are looking at the coding themselves. This is, again, further categories. You can see we have our intraocular lenses on this one, frequently serviced items. So what about this PDAC? So I'm going to look here at LCD policy article A52480. I mentioned earlier about retired LCDs and articles. What other LCDs or policy articles are out there? 56 different LCDs and policy articles, where I could be more towards. What gets a little interesting is we think of nebulizers. Well, it's like, well, wait a minute. We have more. And as we could see here, the pressure reducing support services, if you notice, the TENS units aren't here, even though it's a supply. 3 slides, in fact, where we're starting to look at the knee orthosis. The easiest way to really think about when we're talking about the battery devices and chargers. The first one is, especially when you're dealing with, say, maybe a back brace, you're dealing with a orthotic device. So what is custom fabricated? So what about DME modifiers? But it really dictates not only how a payer should pay for those services, but really what's going to happen long-term for them. There are really 3 main common modifiers that we look at. It's not end all be all, but there are 3 main ones. You have your NU for new. Then we have our UE for used and our RR for rental. We have our capped rentals. So how is the RR modifier and how that could impact us? So what are some other Medicare LCD modifiers that you could see? You could see the GA, the GZ, and the KX. What about home health agencies? So there are certain modifiers tied to certain revenue codes that are going to give you either an increased reimbursement of 50%, such as your QB, QF, QG, and QR modifiers. And then you can have other modifiers like the QA and QE that will reduce your payment by 50%. And then you can have modifiers that change, LTRT. So what about NCCI edits? Now, this is where things become really tricky around durable medical equipment. Number one, Medicare, especially when you're dealing with your procedure-to-procedure edits. But Medicare makes it clear that some of their edits are proprietary. They don't publish them. Then you have your medically unlikely edits. Then we have the add-on codes. So I'm going to give you some examples of column 1 to column 2. So let's look at an add-on code example. All of these add-on codes bundle into this one base code. So it looks like a peacock is what I'm showing us. So what about other base codes? So earlier I mentioned like TENS units, powered wheelchairs. So here's base codes for the L5781, Medicare's LCDs, or the policy articles, excuse me. And we can see that again, it continues when we're looking at the L2750. So what about the coverage and supplies in an office setting? So how do coverage, frequency, limits, supplies, and devices come into play? So what about supplies in an office setting? Where do we get those guidelines from? CPT manual, section guidelines, supplied materials. And that's where you have the supplies in the facility setting as well. I do want to thank everybody for showing up to today's call. So I want to thank everybody today again for joining the call. I look forward to hearing from you in the future should you decide to go ahead and have any more presentations. But I do want to thank everybody again for their time. I do hope that today's presentation was very useful in helping guide everybody onto how to find the correct durable medical equipment codes, what they should be looking for, how the modifiers can impact you, how some of these regulations in a Medicare space can impact you, or in a third-party payer, how the manufacturers, the PDAC, all these different areas will make us stronger in the sense of coding and billing of durable medical equipment and supplies. But thank you again, everybody, for your participation today, and I look forward to seeing you in future presentations.
Thank you, Michael. Thank you once again, Michael. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and you may all have a great day. Bye-bye.
Thank you. Bye-bye.